All right, thank you everyone for joining us today. This is Lad Keith, Assistant Professor in Planning at the University of Arizona. And we've started this extreme heat network based on some of our past work with NOAA through the CLIMAS, Climate Assessment through the Southwest, where some of the communities that we were working with really wanted to be connected to the research and practice in other places going on. So we've started this webinar series. Today we're very happy to have Matthew Roach join us from Arizona Department of Health Services to talk about some of their tools to track environmental health in a spatial way that could help some of the communities out in Arizona, but he's also going to talk a little bit more broadly too about resources available outside of Arizona. So while this webinar is certainly going to be helpful for our Arizona partners, Matt's going to offer some advice for those outside of the state too for similar tools in other places. So next slide. And just a reminder, for those that haven't joined us before, we're kind of bootstrapping this webinar series. So we're using a Zoom meeting. And that means that if everyone could keep their webcams and microphones turned off to reduce the feedback that we get. And we'll be recording this webinar. It'll be available on a YouTube page later on. So we'll send that information out too. And after Matt concludes his presentation, we'll have questions and answers. And so you should be able to see a Zoom chat box. If you look at the bottom of your Zoom screen, you can click on that and type your questions in, and I'll moderate those questions at the end of the presentation, depending on how much time there is. You can also press Alt-H to open up that Zoom group chat box. So we will have time for questions and answers at the end, and we'll do it through chats to make it a little bit more manageable. Next slide. And with that, I'd like to turn it over to our guest speaker today, Matthew Roach. And again, he's with the Arizona Department of Health Services. So Matt, I'll let you take it from here.
Thanks, Lad. Good afternoon, everyone. This is Matt Roach from the Office of Environmental Health at the Arizona Department of Health Services. Here at the department, I wear a few hats, as I'm sure many of you do as well. I oversee our environmental public health tracking program, our climate and health program, and our drinking water program. And I'm going to discuss today about environmental public health tracking and how the data helps inform the work on heat illness prevention for our climate and health program. As you know, Arizona is known for its extreme heat. We have many parts of the state receiving more than 100 days over 100 degrees each year. And with that comes increased risk for heat-related illness. Our program tracks heat deaths, and as you can see, last year we had 251 heat deaths. And this trend seems to be increasing. Heat deaths are preventable, but we see certain segments of the population from the data are more affected. This data helps us identify that we may need to do more intervention work for these populations. So even seasoned residents of Arizona who believe they are adjusted to the heat can be affected. 75% of the deaths were Arizona residents, and more than half were over 55 years old, and most were male. We also know that most cases occur between May and September, which is when organizations may want to ramp up heat-related activities. We also see that most deaths occurring in our larger populated areas like Maricopa, where Phoenix is, and Yuma County, where Tucson is located. Heat illness emergency department visits are increasing to almost 3,000 per year, and we can see that increasing trend. Looking at who is going into the ED, as opposed to a larger portion of the deaths being older adults, we see 45% of cases were young adults between 20 and 44 years old. Most were Arizona residents and male. Again, most cases occurred in our most populated areas from May to September. So why do we need tracking? How did this topic come about regarding environmental health issues? In September of 2000, the Pew Environmental Health Commission issued a report entitled America's Environmental Health Gap, Why the Country Needs a Nationwide Health Tracking Network. The report documented that existing environmental health systems were inadequate, fragmented, and siloed. Environmental and health fields were often separated both physically and philosophically. So in response to that report, Congress appropriated funds in 2002 budget for CDC to establish the National Environmental Public Health Tracking Program and since then has appropriated funds each year to continue this effort. Environmental public health tracking, or as many people call it, tracking, it strives to bring together data that were previously collected for different purposes and stored in separate systems. The program works to identify data sources, assess data quality, and develop nationally standardized measures that allow for comparisons across time and across different geographies. The program essentially sets up a system that tries to bring together many pieces of a puzzle so that we can start to put together that puzzle together and begin to measure all the ways that the environment impacts our health. So what do I mean by tracking? It's the ongoing collection, integration, and analysis and interpretation of data about environmental hazards, exposure to environmental hazards, and the health effects potentially related to those environmental hazards. What data is part of tracking? Information on the environment, population characteristics, and exposures. So when we look at the environment, things like air quality, drinking water, the built environment, and population characteristics. So we're looking at socio-demographics. Where are the people who may have a lower income, and exposures? Where were those toxic substance releases located? Health outcomes are also in the system, such as hospitalizations related to asthma, heart disease, heat stress illness. We have information from our cancer registry on various types of cancers, reproductive and birth outcomes, lead poisoning. There are more than 200 or 300 indicators that are in this network that are being collected systematically. So what do I mean by systematic? An important piece regarding tracking is that many people are doing work in this area, but they may be applying different methods. This would make it hard to compare apples to apples. So as part of the National Tracking Network, the CDC and state grantees will try to create how-to guides for all of us to track things the same way so that we can compare things like county to county or state to state. And instructions are given on creating counts and rates for these various indicators that I previously mentioned. Data in this network is assessed for quality, completeness, and geographic resolution. For example, you don't want to include a data indicator that is missing for 90% of the counties in your state. That might not be useful for county stakeholders. Additionally, if you identify that the data you're working with is missing a lot of data points, such as missing hospitalization data for a hospitalization network in a county, it may lead to inaccurate representations on the burden of that disease. So where does all of this information come from? It comes from a lot of sources and is ever expanding as stakeholder relationships develop. Here are a few of the sources. So at the federal level, the CDC collects data, National Weather Service has weather data, the Environmental Protection Agency has air quality data. The states also contribute data as well, both at the State Health Department and State Department of Environmental Qualities, and poison control centers produce information related to health. Then there are other partnerships, such as with the American Hospital Association or the North American Land Data Assimilation System. So these are just a few of the many sources that are out there that are integrated into this national network. So what do I mean by this national network? The CDC funds 26 state and local health departments to build and implement local tracking programs and data networks. So in addition to one national portal that these states submit to, individual grantees also maintain their own websites or portals, as they're called. So you can see in the western part of the states, the Four Corners area, including New Mexico, Colorado, and Utah, have this grant as well. State and city grantees contribute data towards the network and their own portals. For example, we worked on CDC facilitated work groups to develop the national data standards. We also identified new data sources and environmental health topics of interest in these work groups, and we fostered collaborations among the many fields working on these issues. So there are a lot of different stakeholder groups, and you can see tracking as a way to centralize all of that together to make information easily accessible in one place, instead of going to multiple different databases and spending a lot of time. So what is the difference between the national and the local programs? The CDC has a national network of county and state level data. At the state website, you may find information at the county and sub-county scale. Additionally, you may find indicators of particular interest just to that state. For example, in Arizona, we added information on valley fever, a respiratory illness caused by a fungus in the soil, where most of the cases are found here in our state. So overall data can be accessed on the national portal by accessing their Data Explorer, and data can be viewed as maps, charts, and tables. Here's an example of data the CDC grabbed from the US Census American Community Survey, which shows estimates of the population by county. The darker colors represent a larger population. So this is at the state level. Here you can see state level data comparisons regarding the number of people receiving data from public water systems. Funded tracking states provided this data to CDC, so you can see there are gaps across the country. Nationally, there is a push, though, to get more states contributing. So when you're looking at the national network, this may be an issue among many different indicators. So I guess I got ahead of myself, but you may ask, how do I find all of this information? Here's the website link for the CDC tracking network. If you click on Access the new Data Explorer to start your query, you can get into that system to access the data. You can also click on the Info by Location tool in the middle to view an infographic for county or zip code specific information. Additionally, you can also find each state's tracking portal by clicking on the box to the right. So the website is EPHtracking.cdc.gov. So here's what the CDC's Data Explorer starts with. On the left side, you see step 1. Follow through the steps to create your search. You can select a content area, an indicator, and a measure. You can also select the geography type you're interested in, such as state-to-state comparisons or county comparisons. If we have time later, I'll go through an example. So Arizona's program was first funded in 2017. We're under a 5-year grant cycle with the CDC, and in 2018, we actually launched an improved Arizona Data Explorer using Esri software and GIS as our back end. We compiled historic data sets and added new features to the Data Explorer since then. Here's a link to our website. It's pretty simple, azdhs.gov/EPHT. You can access our own state Data Explorer by clicking on the icon AZ EPHT Explorer. Similar to the CDC's Info by Location tool that I previously mentioned, we also have a Quick Reports feature on the right. So that is on the right-hand side of the screen, you can see it. Here's a zoomed in portion of what it looks like. So Quick Reports allows you to type in any address and get information about that community. As opposed to the CDC's tool, which gives you county level information, Arizona's tool will pull up sub-county community level information if it is available. Here you can see we have an example of the address where the state health department is located here in Phoenix. So if we type in that address, hit submit, here we can see what pops up. It's demographic information about the community where our health department is located, sub-county information about socioeconomics, education, and demographics. At the bottom of the screen, you can also see that you can export the information to a PDF for printing or putting on one of your reports. So this is not all that information that is in there. So many different indicators will pop up on this reporting tool. And here is another section which discusses extreme heat. You can see for the year 2016, the highest temperature was 118 degrees, and there were 135 days over 90 degrees and about 1,400 ED visits from May through September for Arizona residents. Here's the website to access the Data Explorer for Arizona directly. You can also get to this by going to azdhs.gov/EPHT. You can see our Data Explorer is very similar to the CDC's, with maps, charts, and tables for Arizona data. One thing to point out, you'll see a blue box that is on the center of the screen. This box will pop up in the center for the very first time you access the website. It provides a link to our video tutorial. The video tutorial is on YouTube and will provide instructions on how to navigate through our query system. It will also discuss different features such as how to download data and where to find details about the data we have on the Data Explorer, also known as metadata. So we find this useful in a lot of classroom settings when students are using this tool. Here are a few examples of the type of climate-related data we have on our website, such as drought, precipitation, flood vulnerability, extreme heat, wildfires, and property and crop loss. If we click on county level data and the climate content area, you'll see the list of topics I just mentioned. Let's look at just one of these, future projections of extreme heat. Under future projections, you'll see indicators such as the future projected number of days over 100 degrees under a low or high emissions climate projection, or the number of nights over 75 degrees for each year. We know that extreme heat still plagues us in Arizona at nighttime, and this is especially concerning for our homeless individuals. As I mentioned for county level data, we can also look backward at historical data such as the number of days over 100 degrees in 2015. Now that I went over some environmental risk factors, let's talk about the health outcomes. Many organizations monitor health outcomes to see if an intervention is working or not, or for situational awareness. The Data Explorer has heat illness, emergency department visits, and inpatient admissions by county and sub-county area. So data can be viewed as numbers and rates. We know that Maricopa has most of the population in Arizona, so showing data by rates looks at the number of cases per 100,000 population to put everyone on the same playing field. You can also see that we can look at the data by year, month, age group, and gender. As I mentioned, you can see data as maps, tables, and graphs. The darker color represents more cases. You can also click on a particular county, either in the map, table, or graph, and then click trend chart over years to see how things have changed over time for a particular county. Or if you wanted to compare 2 counties or 3 counties against each other, you can just click on multiple counties. So earlier in the presentation, I mentioned about Arizona's issue with having large counties that are larger than some US states. ADHS developed sub-county geographies to help get around this issue and make community-level comparisons for stakeholders. We call them primary care areas, and the name is drawn for another legal requirement for our department, which had to create areas for identifying medically underserved areas. But with these different sub-county areas that were developed, they help to provide statistical analysis and incorporate community boundaries. So here you can see there are 15 counties in Arizona with 60% of the population in one county. If we take it a step further, there are 1,500 census tracts. Additionally, with zip codes, they can frequently change over time, so they may not be conducive to looking at trends over time. For example, something that I thought of was, I don't even know my own census tract, so I don't think many people may know theirs either. So with these PCAs, our department develops community area names that people can identify with. Here's a map of the Arizona sub-county areas, including what it looks like for the Metro Phoenix and Tucson areas. It allows us to compare communities when questions come in from the public and other entities. And here are some rules about the PCAs if you're curious. So they were built from the 2010 census tracts, and they have a population greater than 10,000 but less than 200,000. They're not larger than 7,500 square miles and generally do not cross county lines. And they try to follow existing political boundaries closely as possible. And with that health component, because this also serves another purpose for our medically underserved areas, it has to have a safety net facility. There are some exceptions. Tribal PCAs are exempt from population and area minimum and maximum rules and can cross county lines. But based on size and homogeneity, some communities were also allowed to cross a county line, such as Clean Creek and Sedona. So overall, we have 126 of these communities with an average population of 50,000 and an area of 905 square miles. There are 55 PCAs in Phoenix and 20 in Tucson, with Maryvale having the largest and Fort McDowell and Yavapai is the smallest. So what does it look like? We took our heat emergency department visit data, and now we can see where in the state we are seeing communities most affected. This may be where you might want to put an intervention like cooling centers. This wouldn't be possible with the county level data that I showed previously. Additionally, providing more granular data than these PCAs also can backfire because they can violate privacy issues for healthcare data. So based on our suppression methodology and rules that allow us to share something with outside partners without the burdensome data sharing agreement process, we have this information at the PCA scale. So I'm going to try to do a live demo just so you can see how fast the website is and to query an indicator. So here you can see our homepage, and I will click on our EPHT Explorer. Looks like we're having some issues in the background. I'm going to try this with Chrome. So I believe that our website works better on Chrome. So you can see here that the blue boxes here where the video tutorial will load. And we can start here looking at our geography. If we wanted to look at the sub-county area, if we wanted to look at heat stress illness, and you can see we can choose emergency department visits or inpatient admissions, which people would stay in the hospital for more than a day. You can also choose a measure, age-adjusted rate per 100,000 population, the crude rate, or the number of emergency department visits. When we look at the map, you can see these hash marks, which indicate the data has been suppressed, as you see on the screen. So that's when we have less than 6 cases. If you wanted to know more about the indicator that you're looking at, you can click on the question mark. It has information on data details, how it should be cited, why was it created, and what are the limitations of the data set. For more information, you can also go to our indicator links or explanation of measures, and you can also find other things about the video tutorial, visiting the national tracking website, and our newsletter sign up. You can also zoom in on the portal if you need to look at something. And as I mentioned before, you can click on multiple areas to compare them. And when you click on something, you'll notice something interactive. In the table, it will highlight what you clicked on, and also down in the graph, it'll highlight where it is. So you can see here, Central City Village, where the health department is located, has one of the highest rates for heat-related illness. We can see how it compares to other areas, like the area south of it, South Mountain Village. And we can see how far down that is compared to Central City Village. If you want to look over time, you can click on Trend Chart over years to see how the data has changed over time. So I hope that gives you a look into how to use this information. One other feature I wanted to show you is you can download this data and it will download in Excel format. You can also go to an advanced download features. If you're interested in all the years of data or one, you can do that as well to grab everything in here. So I also want to share some other resources. We have an extreme heat website that you can find at azdhs.gov/heat. And we are not just putting together data for just data collecting purposes, and that's not the end game. So we have information on how to recognize, treat, and prevent heat-related illness. We have a sign up for heat alerts, toolkits for older adults, outdoor workers, and schools, and data reports for people to use on heat and other factors. So the purpose of environmental public health tracking is to inform public health action, and you can see how this data can inform our other grant, which is our Climate Ready States and Cities initiative to implement informed interventions for where we want to put them for the populations most affected. We have many heat-related reports and activities of interest that you may be interested in reading about, and they can be found at this link on the page or by going to azdhs.gov/heat. The Arizona Climate Health Adaptation Plan is one of those reports. It is a strategic plan which focuses on public health interventions organizations can take to reduce the effects of current and future climate-sensitive public health hazards. So this was informed with our university partners, where we did a literature review to identify different interventions, and then we also reached out to county health departments to see if these interventions were also feasible. In its current iteration, the plan provides a list of suggested activities that stakeholders can consider in their own adaptation plans. It also highlights examples collected from across the state as to what is currently being done, such as tracking hospitalizations for heat health outcomes. We also have a new report that came out recently, which highlights public health interventions from our adaptation plan, where we partnered around the state with different jurisdictions. We hope to update this again soon. So this report can also provide guidance on how others may want to replicate lessons learned. For example, in Yuma County, this is one of the stories that we have in that report. Their public health department, in partnership with ADHS and AASU, surveyed the homeless and cooling center staff about awareness of the cooling centers and use of them in Yuma County. They also provided water bottles and cooling towels to almost 100 homeless individuals in a day during the summer. And the information collected can identify gaps in cooling centers for where they may want to add new ones. Here are some of the results from that initiative. We learned how people get to cooling centers, how they find out about them, if they experience heat illness, and if they felt their health was in danger and see it as a priority. And that is a picture of the survey team, and the bags are kind of the materials that were given out to the homeless individuals when we surveyed to help them cope with the heat. We also implemented a social media campaign with National Weather Service about heat awareness. And this has occurred for the past several years at the end of May and led to more than 400,000 views on our social media and website that discussed heat-related illness prevention. It was also shared in the media with several news stories talking about Heat Awareness Week when the heat was ramping up. We also, for several years, have sent out National Weather Service heat warning messaging to an email listserv. Currently, about 9,000 Arizonans are signed up to receive heat alerts from us that have public health safety tips. So you can see here there are two different alerts. One of them is also tailored to schools. And with schools back in session, we have actually nearly 3,000 school officials signed up for our school heat alerts, which offer tailored messaging to protect students and staff during heat warnings. ADHS also developed a school heat toolkit, which you saw on the overall heat website, that can help school staff learn about recognition, treatment, and prevention of heat-related illness. You can also sign up for these heat alerts at azdhs.gov/heat. We also host an annual state heat meeting in collaboration with National Weather Service and our local universities. Earlier this spring, we had more than 100 people from academia, businesses, elected officials, emergency management, government, media, nonprofits, tribes, public safety, and more. And with this, you can see the range of topics that were covered during this meeting, which pulling all these people together helps make awareness of these resources used that might have otherwise been unknown. For example, there are home weatherization programs that will pay for air conditioning repair for people who don't have the income to fix their AC during the hottest part of the year. And if the partners working on heat that interact with people such as those that are low income don't know about these resources, they may not be known, and you can hinder the protection aspect for heat-related illness. So things that were discussed, such as school heat policies, data, summer pet safety, emergency outreach, city planning, and neighborhood actions, and what the National Weather Service tools offer. So I want to thank you for listening about our work. This funding for this was provided by the CDC's Environmental Public Health Tracking Grant and the Climate Ready States and Cities Initiative Grant from the CDC. And that concludes my presentation. I can take any questions.
Great, thank you so much, Matt. And again, if you have any questions, if you could go ahead and type those into the Zoom group chat. Again, it should be accessible on the lower screen of your Zoom screen, and then it pops up and it's on the right-hand side. Matt, I had a question to get you started off. You've collaborated a lot with cities across the state. Do you have any advice for any of our webinar listeners that might be thinking of collaborating in the area of heat? Like, what are some lessons learned from the work that you've done so far?
Sure. So many jurisdictions are creating adaptation plans for climate or emergency preparedness plans, and they want to look and see, where do I start with gathering information about heat and heat hospitalizations or heat deaths? And from the presentation that I just gave, you can use this information to inform your emergency response plans about the hazard. You can also use the information to prioritize different hazards as well, or certain segments of the population or areas within your county or that you may want to focus on. So I think that is one area. Another aspect is if you're applying for grants for protection, you can use this information to justify the work involved to protect the residents in your area.
Great, that's good advice. One more question that I get asked a lot in my work with other cities outside of Arizona is kind of how Arizona compares with other states for how we track the heat health kind of impacts, and some states are further behind. So do you have any recommendations on that aspect in states that might have less of a tracking mechanism for the impacts of heat on health? So I mentioned earlier that the CDC's tracking network has metadata, and in that metadata, it provides information on how to track heat-related impacts, such as the hospitalizations, and that is publicly available online at both the national site and at our state site of how to gather that information from the health department. Additionally, on the weather side of things, the national tracking portal has gathered information on historical and projected temperatures, et cetera, for the entire nation, regardless of the health department. And that is from national sources, and that can be used by anyone that's even not funded by the tracking grant. Great, and then one more question that I had kind of asked before this webinar started was, are there any national networks outside of the CDC or other groups that you would recommend folks outside of the state of Arizona connecting with on this topic? So it depends on your scale, but there are a lot of different groups in the public health realm that are working on this. At the city and county scale, there is an organization called NACCHO
the National Association of City and County Health Officials. They have a program that talks about climate-related impacts. At the state level, there's the Association of State and Territorial Health Officials has a work group. If you are more epidemiology focused, there is a work group under the Council of State and Territorial Epidemiologists, and these are all available for anyone to join. Locally here in Arizona, I mentioned that we hosted the State Heat Workshop on an annual basis, and anyone is welcome to attend. You can reach out to me and I can put you on a list to join in the next year. One of the aspects that I think we're going to try to look into next year is to invite some of our partners and collaborators from across the border and Mexico and invite them to our meeting. They have shown some interest in heat-related illness. We also previously have had people from other states see how we are interacting with multiple stakeholder fields to tackle this large issue. So welcome you all to join on the conversation.
Great, thank you so much, Matt. And thanks again, this is going to be a wonderful resource when we get it posted up on YouTube later on. So if you want to go to the next slide. Great, so again, thank you to Matt for the time he put in preparing this presentation. Just a couple of network updates to share with everyone. We had mentioned this previously, but the Urban Land Institute has a new report out called Scorched, and it's on extreme heat and real estate, but it's really looking at how to become a more heat resilient community through both the public and private sectors kind of in the built environment. So that report is available at uli.org. It's probably easiest actually though just to Google Urban Land Institute and the name of the report, so Extreme Heat. So that's a great resource that's out there now that was just launched last month. Another resource we wanted to share is that NOAA has a new weekly Heat Beat newsletter, and you can subscribe by contacting the email address that's on the screen, so NOAA Climate Connection at noaa.gov. And that's been coming out once a week, and they share different updates that are going on across the country related to extreme heat. And again, we thank Matt for his time. I want to thank Tess Wagner, my graduate research assistant, because she's the one who helps put all of the announcements together for this webinar series. And if anyone has any questions or suggestions about future webinar topics, please reach out. My email is ladd@arizona.edu. Thanks so much.